We are in a unique time and place. An increasing number of students with disabilities are entering and completing higher education, thanks in part to an amazing group of disability professionals and equal access advocates. Many of these same students are aspiring for a career in the health professions and entering health professions education in growing numbers. In order to provide the same level of access, we need to increase the number of disability resource providers with expert knowledge of clinical education.
What happens when a student with a disability enters health professions education? There are a multitude of pathways that can follow. Students can have an amazing experience. They can enter a program that employs a disability resource professional, specialized in health professions, and with a command of equal access for health professions education. Unfortunately, there's an equal chance that a student will enter an environment where there exists a lack of specialization in health professions education, and where deeply entrenched ableist views of disability dominate the discourse and the actions, or lack of action, regarding disability access.
What impacts this pathway? Barriers arise when the structures are uninformed, that is, when the arbiter of decision-making is absent knowledge of the curriculum and assessment requirements, absent knowledge of best and emerging accommodation practices across multiple settings and assessment styles, and absent knowledge of relevant disability law and case law involving health professions education as evidenced by these student testimonials.
Now that UCLA has a dedicated disability resource provider, it's really been like night and day in terms of having more accessible medical education. First of all, it's just so lovely to know exactly the correct point person to ask when we as students have questions about what can be a kind of complicated process. But I think that the other really nice thing about having a disability resource provider is that that person is up to date about all the little odds and ends. I think that we focus a lot on getting accommodations for the NBME step exams because in terms of we as disabled students, know that that's such a big hurdle.
When uninformed structures are in place, students face additional burdens. Studies show that students with disabilities often avoid disclosing their disability and requesting accommodations for fear of bias, stigma, and misperceptions about performance.
This is especially true when students are subject to support structures that foster conflict of interest, like faculty committees making disability accommodation determinations, or when the disability professional does not understand the clinical environment.
When I was about to start the third year of medical school, I had very little idea what the training environment on the wards would be like, or what accommodations would even be possible. But when I approached my DSP for advice about this, she unfortunately told me that she had even less knowledge about the training environment than I did. This left me little choice but to approach the director of my first clinical rotation and disclose my full health situation to her so that she could explain to me what accommodations would be appropriate. Based on her feedback, my DSP and I cobbled together an accommodations letter with wording that implied that my accommodations were optional rather than necessary to my daily functioning and health. As a result, my accommodations were insufficient for my needs, and they were repeatedly denied.
To ensure that health professionals' education is accessible, it's important to employ a specialized disability resource professional. This individual aids the student and the faculty in navigating the interactive process and developing effective accommodations in the classroom and in the clinical space.
Providing access in nursing, medicine, medical laboratory sciences, occupational therapy, speech-language pathology, audiology, and other advanced level health science programs requires a unique understanding of program requirements, accreditation requirements, and technical standards. It also requires experience with implementing accommodations in each of the unique settings our students navigate during their training.
A thorough understanding and appreciation for the varying curricular expectations and requirements that exist within the very complex clinical education space. Each clinical clerkship can have a different focus, from demonstrating procedural skills to conducting examinations to doing write-ups to diagnosis, care provision, to patient communication. Every rotation will highlight different areas of clinical medicine. So being familiar with these focus areas and the potential barriers they present is critical to facilitating access.
Come to realize the importance of bandwidth and specialized knowledge in disability resource providers so that we're able to support students through complicated high-stakes testing processes like the USMLE STEP exams. This was reinforced in my current position as a disability resource provider for a medical school. I was surprised when I was talking to third-year students who weren't seeking accommodations on the STEP exams, and when asked why, responded fairly similarly, saying they talked to friends and other individuals in the program, and they found the process to be complicated, anxiety-producing, and despite all their efforts, they were still denied and, couldn't afford an attorney, which seemed to be the only option for those who eventually were successful. So it didn't seem like a feasible, kind of use of their time. As a disability resource provider and advocate, that was hard to hear. Students foregoing reasonable accommodations that they truly needed to be successful and to have equal access to that exam because the process was arduous and difficult to navigate. And, I think it's important for institutions to think about how having accommodations can mean the difference between that student passing the exam or not, or more importantly, the difference between that student continuing in the program or not. So from a medical school or health science program perspective, this kind of support should be thought of as a matriculation and graduation tool, as well as a mechanism for equal access. And it's amazing how a little support can go a really long way.
Unfortunately, when DRPs lack knowledge of health professions education and clinical accommodation, a student's trust in the school to meet their disability-related needs can be undermined. Indeed, a lack of expertise among DRPs may send an implicit message that accommodating disability-related barriers and commitments to disability inclusion are not a high priority. Moreover, it implicitly communicates that health professions education students cannot be disabled and do not require accommodations, as evidenced by the lack of service and personnel to support the specific needs of this population. Sadly, the lack of health professions education-informed DRPs sends a covert message about the appropriateness of including students with disabilities in these programs, perpetuating long-standing ableist views. In doing so, these messages inform the climate around disability disclosure and stigma and run counter to the stated commitments to diversify and provide equity and inclusion. But things are about to change. Medical education is leading reform in this area. Medical associations now recognize how valuable DRPs are to the full and positive inclusion of disabled learners. Indeed, 2 leading medical associations address these issues in their reports. The AMA recommendation states that all medical schools and graduate medical institutions make available to students and trainees a designated qualified person or committee knowledgeable of the Americans with Disabilities Act and available support services, while the Association for American Medical Colleges, the AAMC, says that schools should designate a disability service provider for the medical school, someone with specialized training in disability services and disability law. This person should be situated in one of several offices under the umbrella of diversity, inclusion, student wellness, and academic support. With these recommendations come opportunities for disability resource professionals to become specialized and enter the world of health professions education. Currently, there are not enough DRPs to staff the open positions. Even if a school wants to adhere to the guidance and employ a specialized DRP, it could take months, even years, to find one.
So how do you become more specialized in the practice? There are multiple resources available to assist current DRPs with self-study on the topic, including recently published books, the Docs With Disability podcast, and work from the Coalition as well as the Access in Medicine Working Group.
Finally, a new Disability Resource Professional, or DRP, training academy is launching this winter, specifically designed to train current disability providers in the nuanced area of health professions.
We are excited about the future of access in health professions and invite you to explore our respective organizations to get updated information and resources on disability inclusion.